Before we can understand how the drugs work, we'll need to take a look at the arachidonic acid pathway and understand the normal physiology. Though it may take a little effort, memorizing this pathway should prove fairly high yield, as it tends to be one of the more often tested pharmacological pathways, since aspirin, NSAIDs, and acetaminophen all affect it in some way and are all very common drugs. Let's go through it together. I'd recommend copying it down as we go. Let's start at the beginning. Where does the whole process start? Well, the plasma membrane of the cell of many different cells in the body. A single membrane lipid is taken by phospholipase A2 and is converted into arachidonic acid. With this arachidonic acid, there are two directions it can go, either down the lipoxygenase pathway or the cyclooxygenase pathway. The lipoxygenase pathway is simple. Arachidonic acid is ultimately converted into leukotrienes, including LTB, C, and D. Do you recall what LTB4 does from pathology? Very good, neutrophil chemotaxis. LTC and LTD are potent bronchoconstrictors. Now, while you won't see these again until the respiratory lectures, the drugs Xylutin, Zarfalucast, and Montelukast all block this lipoxygenase pathway, as it tends to be an effective treatment option to prevent bronchoconstriction in patients with asthma, especially if the asthma happens to be aspirin-induced. To help remember these drugs, note that they all contain Lu in their names. The second pathway that arachidonic acid can take is the cyclooxygenase pathway, or the COX-1 and COX-2 pathway, which converts arachidonic acid into three molecules. The first two are in some sense mirrors of each other. Prostacyclin, or PGI2, decreases platelet aggregation and also vasodilates, while thromboxane increases platelet aggregation and vasoconstricts. One way to remember that thromboxane increases platelet aggregation is in the name. Thrombo is also the root for thrombus, or clot. Now, how do these two molecules function in the body together? Well, they balance each other out to ensure that vascular tone is being regulated appropriately, as is the appropriate activity of the hemostatic pathways. The third product is prostaglandins, like PGE2. These have a wide variety of effects, including decreased vascular tone, increased pain sensation, and increased uterine tone. Can you guess which one of these three molecules is responsible for menstrual cramps? Very good, prostaglandins. They increase uterine tone and are responsible for cramping when the uterus sloughs. Many drugs affect the COX pathways, namely NSAIDs, acetaminophen, and aspirin, which are all nonspecific and block both COX-1 and COX-2. There are specific COX-2 inhibitors that allow the COX-1 pathway to remain intact, which we'll talk about in a few minutes. Corticosteroids also function to block both arms of this pathway. Now, what do they work on? Very good, phospholipase A2 activity, and also the protein synthesis that creates the enzymes COX-1 and COX-2. By doing so, steroids can also be potent anti-inflammatory drugs. Flash quiz. Where does the arachidonic acid pathway start? In the cell membrane with a single phospholipid that is processed by phospholipase A2.